Mr Speaker, I rise on behalf of New Zealand First to take a call on the Health Protection Amendment Bill. Mr Speaker, New Zealand First supports this bill. We believe that the changes that the bill makes are very timely, and the bill makes a great number of changes to the public health system that are needed. We knew that there were concerns about the way that the current legislation was not meeting the needs that health professionals are identifying. So this is very timely. And of course, like others on the Health Select Committee, I'm looking forward to working further on this bill. But very firstly, I'd like to speak to the first section of the bill that deals with tracing people who have an infectious disease or may have been exposed to one. There is nothing surer than the fact that we need timely data on this, and it will reduce the need for people wondering about whether or not they have actually contacted a disease. We know that the voluntary involvement in reporting is not really good enough. We know people are travelling far more than they ever have, and if there is a disease that they may have been exposed to or picked up and brought back to New Zealand, we need to know fairly quickly. And we've got the example of the Ebola disease, and we appreciate that the Ministry of Health is focusing on this and taking measures to try and ensure that New Zealanders are not exposed to it, and if somebody comes into the country that has contacted Ebola, we've got some system in place to actually deal with it, and that's what needs to happen. Previous speakers have listed the wide range of diseases that are contactable to the Ministry of Health. We believe that some people may consider these rules too strict, but they're essential to the health of New Zealanders, which we totally support. In particular, the bill requires that medical health professionals keep details of all of those with infectious diseases private to the fullest extent possible. We believe that this will be a real challenge, but we appreciate that New Zealanders definitely need certainty with their health care. So we'll be interested through the Select Committee process to see exactly how this is going to happen. In New Zealand First, we support preventative measures rather than reactive measures, and this is really a good start in this field. But this bill, we're pleased, is very first on the order paper, or pretty soon in the first bracket of Parliament, because action needs to be taken. Again, we're very happy to see that the government has decided to take some action on tanning salons and tanning services and sunbeds. And we can credit that to Dr Hutchison and questions, timely questions, written questions from New Zealand First, because we believe that it is timely to ban sunbeds to people under the age of 18. I recall in my a few years ago going to a tanning salon, trying to get the golden tan that New Zealanders like, and the lady told me that no, I would not get the tan that I thought I was going to get, that I would stay instead with my vegetable tan, red as a beetroot and peel like an onion, and I didn't expect to get that from a tanning salon. So we think that this is a small step forwards and we welcome it, but we don't think it really goes far enough, because every Australian state has now either banned or is planning to outlaw these commercial sunbeds. And we know that Australians have some of the highest rates of skin cancer in the world. We previously asked the Honourable Tony Ryle, whether or not he planned to follow the Australian example. And the answer that we got back was no, he had no plans at that particular time. So we're very happy to see this coming through. We know that there's absolutely nothing in New Zealand that checks and regulates these sunbeds apart from voluntary guidelines. We know that there needs to be monitoring of the sunbeds as to the intensity of the light that the beds are emitting and the length of time that people actually spend in them. But nobody has ever measured the light. So whether or not it is at the recommended rate or it is higher than that rate is totally unknown. The total registration rate for melanoma has decreased in New Zealand by 13.4% between 2001 and 2011. But unfortunately, the mortality rate increased by 12.3%. So we know there needs to be more action to reduce this number, and banning sunbeds would be a very significant step towards that. Skin cancer is one of the most common cancers in New Zealand, and we all need to be taking action to help reduce that particular rate. I know that when we were over in Australia, as a previous speaker has mentioned, we were surprised to see that all of the workers outside were totally clothed. There was no bit of skin exposed to the sun over there, and something that perhaps we may need to consider here in New Zealand. The bill also makes a number of administrative changes that will streamline legislation. Most noticeable, of course, is the inclusion of tuberculosis as an infectious disease under the Health Act 1956 and the consequent repeal of the Tuberculosis Act of 1948. The facts show that cases of MDR, that's multi-drug resistant TB, have been trending upward for some years, the last 15 years in fact, largely driven, we believe, by the increasing number of migrants that are coming into New Zealand and the fact that there is no real check on whether or not they have this drug-resistant TB. So we would be most interested to see that streamlining and repealing the Tuberculosis Act, whether or not it's had any positive changes on the TB rates in New Zealand. In New Zealand First, we've always been supportive of ensuring the best possible health care for New Zealanders. We believe, of course, as I said earlier, that preventative measures are better to achieve this than the reactive measures that we've come to expect from successive governments. So, Mr Speaker, New Zealand First will be supporting this bill as it is working towards protecting the health of all New Zealanders, and we look forward to hearing the submissions from Select Committee and working further on this particular bill. Thank you.
Mr Speaker. Scott Simpson.
Thank you, Mr Speaker. It's a pleasure to